Hi, so welcome to week 10 of pharmacology, and in this week we're going to talk about medication errors. So this is a star class for sure. So in this class we're going to discuss what is a medication error. We're going to discuss also what causes medication errors, and the whole goal is because if you understand what causes medication errors, then we can try to prevent them from happening. So a medication error is different from a documentation error. So last week we talked about a documentation error, which was an error where you just made a spelling mistake or you recorded the medication in the wrong spot in the documentation. An actual medication error is when the wrong drug is prescribed, or the wrong drug is given, or the wrong dosage is given, or the wrong protocol for administering the drug is used. So it's given by the wrong route, or etc. So this is where there's actually a problem with the type and amount of medication that a person receives. So this is quite a lot more serious. It also has to be documented, but there are some other things that you must do as well. So just so that you know, medication errors are fairly unnervingly common in North America, including Canada. So some of the first studies to look at this were in 1999, and there was a study in the U.S. called To Err is Human, and they discovered that between 44 to 55,000 people in the U.S. were killed every year by medication errors, and at that time it was the fourth leading cause of death in North America. In Canada, it's also very serious. It's the most common cause of injury and preventable death that occurs within hospitals. About 1 in 5 nurses in hospital settings, this was in 2013, reported that they made a medication error either occasionally or frequently during the past year. Medication errors affect at least 1.5 million Canadians every year, so 1 in 10 patients receives the wrong drug or the wrong dose while they're in a hospital. The frequency of medication errors varies across the world. Australia seems to be the worst place to get a prescription medicine, where their medication error is around 17%. Ottawa in 2012 was around 13% in terms of medication errors. So a 2013 study of Ontario hospitals, so this was the first year where they had to, there was mandatory reporting of medication errors, and they found 36 adverse events, so where, you know, there was an injury that occurred, and that included 10 deaths, and that was due to medication errors. And this was, as I said, 2013 was the very first year where there was mandatory reporting of medication errors. This little chart here also shows you in terms of, you know, different types of activities, and in terms of, you know, what are dangerous activities, and certainly being in the hospital is one of the most dangerous activities, places, you know, in terms of losing your life. The ISMP, or the Institute for Safe Medication Practices, is an international organization that looks at trying to improve the safety of medication administration. And there is a Canadian contingency, a Canadian organization, so ISMP Canada. They are independent from the government, they are non-profit, and they collect and they analyze medication error reports. And so they were some of the first studies on medication errors in Canada came through the ISMP, and they make recommendations for increasing safety. So they look at the causes of medication errors, and then they try to find solutions to them, whether that's through the pharmaceutical companies or through education of health professionals, or you know, data that they have to collect. So they work really hard to try to increase medication safety. So a lot of the things that we're going to discuss about improving your safe administration of medication come through the ISMP. They collect reporting of errors on a voluntary basis, and And in some places in the country, that's the only place where errors are reported, is on a voluntary basis. This has its advantages in that because it's voluntary and it's non-punitive, meaning that a person couldn't be punished for reporting a medication error, that allows more errors to be reported. And the ISMP's view is that the more people that report errors, the more often that we can discover what the cause is, and then we can work to correct it. Because often it's not just it's not that an individual wants to make an error; it's that there is some sort of common cause underlying that. So, for example, medications look alike, or certain abbreviations seem to cause errors in many different places. And if nobody reports them, then we can't fix that problem. So that's their idea. And they have a way to report those errors, and you should take a look at their website. There's a link up in Blackboard, and it's ismpcanada.org. So they also report not only just if an error has occurred, but also a near miss. So for example, if you almost made an error but caught yourself, again, that's important to report to the ISMP, again, because somebody else may not have caught that error, and it may be there's something common that we can fix. It's entirely confidential, non-punitive, and you can also report if you feel like a situation is unsafe. Just on that last slide, the ISMP also just very recently in 2014 had a voluntary summit in Toronto, and they want to devise a national medication safety plan, and so that's pretty exciting too, if we can have something that is Canada-wide and recommends best practices. So if we look at the literature to find out where medication errors occur, they can occur in many different places. So if you think about, how a medication gets, to a particular individual, it starts right with the research and the pharmaceutical company and their data that they collect, and then of course that goes to Health Canada and their approval process, and then that then goes to the physicians and their ability to prescribe that medication appropriately, and then to the pharmacist, and then to the person that's going to administer the medication, and then finally to the individual. So there are lots of places along that chain where something can happen. So again, if we look at the data, about 19% of medication errors occur in the prescribing phase, so from the physician. About 19% of errors occur in the preparing or dispensing phase, so the pharmacist, and then about 50% of the errors occur in the administration phase, and so that includes things like transcribing information, as we've been doing, right? Transcribing information from the medication order onto an MAR sheet, or passing on instructions right down to the actual administration process. So of course we should be concerned about this 50%, because that is the part that DSWs are involved in. So we're going to go through some of the common causes of medication errors, and as we go through this, I'd like you to ask yourself, what do you do as a DSW to help prevent this error? And one of the biggest things that we're going to come back to again and again and again is that if you are unsure, if you have any doubts at all about what you should be doing, whether you can read the order or not, or whether there's red flags that appear in your head, then you always need to double check. And if that means contacting a pharmacist or a physician to just double check to make sure that you are administering it, or having somebody else check over your work, having a second set of eyes, then do it. So always be on the safe side. So a really big area, and particularly in the past, and less so now that we have computers, but a big factor in making medication errors is poor handwriting. And this, if a physician writes an order that the pharmacist or, a DSW or a health professional can't read, then that's very tricky. So I've got a couple examples here. So this top one here says, and see if you can read this, Lasix, and then this part here, milligrams by mouth today. And the problem was that when the physician wrote this medication order, he or she started to write 100 milligrams and then changed his or her mind and then changed the 1 into a 2. Okay, so what this order should say is Lasix 200 milligrams by mouth today. However, because that looks almost like there's a 1 and a 2 together, then the medication error that was made was that the person received 1,200 milligrams by mouth today instead of 200 milligrams. The second one also is a handwriting issue. That says Lovenox, and that drug was actually, and the Lovenox is an anticoagulant, and I believe this says 4 cc subcutaneous QD every day. I think that's what that says, although this is also dubious. The medication error that was actually made was that this drug, Lovenox, was confused with this drug up here, Lasix, and so the person received Lasix, which is a diuretic, which is given for things like high blood pressure, instead of getting their anticoagulant, Lovenox. So they got the wrong drug. So what do you do as a DSW to prevent that? Okay, star, star, star. So this is another common medication error that's caused by a problem with communication, and in this case it's how numbers and zeros and decimal points are used. And we've talked about one of the things that we can do, which is always write a number 1 as O-N-E, right? So because 1 can look like an L, it can look like a T, it can look like a 1, so and that can be confusing. Along those lines, the number 7 also can look like a 1 as well, and so it's recommended that instead of writing 7, just at normal, you put a little line through it, and that indicates a 7, and then that helps distinguish it from a 1. A really important thing that we discussed earlier in the year was the use of zeros and decimal points. So for example, if you look in this top order, this was an actual medication error that was made, and this actually says 2.0 milligrams by mouth, and but because the 0 followed the decimal point, and we lost the decimal point in the lined paper, this person was given 20 milligrams instead of 2 milligrams. So the rule is that never use a 0 by itself after a decimal point. In the bottom order, this was another medication error. So terbutaline, and it says 0.5 milligrams now, subcutaneous. And of course the decimal point was lost also, so the person received 5 milligrams instead of 0.5 milligrams. And again, that's they received the wrong dose. So always put a 0 before a decimal point so that we know that the decimal point is there. Sometimes there can be confusion between different units, and here's a couple examples of where this can happen. So in the left-hand side you see this cup, and this cup actually has different units on different sides of the cup. And on this side of the cup it says drams, and on the other side it would say mils. And in this particular case, the person was supposed to receive 5 mils, but instead they received 5 drams of this liquid. So, and it was a nurse that actually measured 5 drams. Well, 5 drams is the equivalent to about 18.5 mils. So again, the person received much more medication than what they were supposed to receive. In the right-hand side is a similar case. This actually was a father that bought medication, just acetaminophen, over the counter, and the dosage, as written on the package, was 12.5 milligrams. But then when you look over here on the dosing cup, this says 12.5 mils, and so the father actually filled the cup up to 12.5 mils and was ready to give that to his son. But the amount of the drug that's contained in 12.5 mils is 31 milligrams. So again, if the dosing written on the packaging is in milligrams and then the cup is measured in mils, then that can create that type of error. Now that was a near miss, so the father caught that mistake and then reported it. And and since then, the packaging has to be quite a lot clearer in terms of how how the dosage is reported, and it should match with the little cup that comes with the medication. Another thing that can cause a problem with communicating orders is using inappropriate abbreviations, and we've touched on this already. In the top one, other than just being horrible handwriting as well, the big mistake came with this, is that this says MORPH, so morph, okay, and they used an abbreviation for a drug. Instead of saying morphine, they just wrote morph. And this person actually received hydromorphone, which is quite a lot stronger than morphone. And so when they received it at that dosage, it actually caused a fatal event. So the rule is never, ever, ever, ever abbreviate a drug name. The drug name has to be written out in full, and preferably also with both generic and brand names, because that gives an opportunity to double check whether or not you've got the right drug. The second one, the order is supposed to say run at, so this was an IV, run at 5 mils per hour. But this abbreviation for at, okay, which we shouldn't use, looks like a 2. And so this person received, instead of receiving an infusion at 5 mils per hour, they received an infusion at 25 mils per hour. And the last one I think we've looked at already. Again, this is an abbreviation for units, and so it's supposed to say 6U, 6 units, regular insulin now, and instead they received 60 because the U was mistaken for a 0. And again, that was a fatal event. So the ISMP has made a list of abbreviations that we should avoid, and we've been talking about them, and here's a list. So units and international units should be written out in full. QD or QOD, so daily or every other day, again written out. Same with right eye, left eye, both eyes. DC is discontinue, and that's okay, but if you want to write discharge, you're supposed to write that out entirely. Instead of using a unit of cc's, we should be using mils. The microgram, at, greater than, less than shouldn't be used because they can be mistaken for a number, and then any abbreviation for a drug. Sometimes the intent of the drug or the route of the drug is mistaken, and I think we talked about this. This was not a fatal event, although it didn't help their ear infection. This says 2 drops Garrisone in our ear, so right ear. Of course, that's not the right abbreviation for right ear, and so it was confused as to how that drug was supposed to be administered, so they ended up giving drops rectally, so in the rear. And the last one is important as well, and that is verbal orders. So these are orders that are given over the phone. And as a rule, DSWs should not receive verbal orders. So somebody cannot phone you up and give you a medication order over the phone. So it should be in writing for DSWs. And part of the reason is there's a protocol, and here's an example of where a medication error was made. So somebody said over the phone 2 50 milligram indomethacin suppositories. Okay, and of course what they heard over the phone was 250 milligrams indomethacin suppositories. And so the person received 250 milligrams instead of 2 50 milligram suppositories. And so they received, again, a greater amount of that medication than what they were supposed to receive. Okay, so we're going to start. This will be the end of part 1, and we'll pick up here where we left off in part 2.